they kind of think that if you talk to patients about complications, they're not going to trust you and your case acceptance may go down. Yes, your case acceptance may go down, but those are probably the patients that you don't want to treat anyways.
Amen.
Because let's talk about this. When you think of how many complications do we have in dentistry, it's low.
Yeah.
It's low. Think of every time you prepped a crown and the amount of time you had to send it back to the lab. Maybe 5%.
Yep.
Right? 1 out of 20, the
Yep.
contact's open, the margin's open, the occlusion's high, the shade's off, whatever. When you talk about implants, we have a very long decades and decades of studies showing implant rates. They're pretty darn good. They're in the mid to high 90s over 10 years. I mean, pretty darn high. So you're thinking about complications as a few percentage points. That is where we can get in trouble because it's like, well, gosh, if it's 3%, why talk to every single patient about this? And my answer is, when I think back about the patients that drove me crazy, that I stayed up all night, that I cried about, that I talked to my wife about, that I called my brother and my dad, it was that 2%.